The second most dominant cell that we find within the dermis is the macrophage. And the macrophage is a phagocytic cell that is responsible for phagocytosis. The macrophage in this case accounts for around about 10% of cell composition. I want you to imagine that the macrophage is a lot like a crocodile. So it identifies the pathogen, and then it processes that pathogen, and we call this process phagocytosis. So with this, your macrophage and its proactivity is responsible for a proactive wound healing response. This links in with platelet quality, growth factor quality, and your repair and rejuvenating response in order to facilitate healing, in order to facilitate rejuvenation. With this, what is the difference between a proactive macrophage and a proactive healing response as opposed to an inactive one? Well, again, we look to diet and we look to the fuel that goes into this machine. Some considerations, particularly to support platelets, to support growth factors, and to support the regenerative and repair process. First consideration for this. I'm going to call this macrophage maximization. For 2 weeks prior to any regenerative procedure, can I suggest that your patient removes trans fats out of the diet? These will affect the quality of your white blood cells. These will affect the quality of platelets. Can I also suggest that your patient removes free sugar from their diet? Sugar is responsible for glycation, binding on to collagen protein and then attacking it. Sugar is also highly acidic, and sugar also contributes to inflammation within the diet. As tough as this one may be, for 2 weeks prior to treatment, can I also recommend that your patient removes alcohol from their diet? Again, this creates sugar, this creates inflammation, but this also delivers acidity into the digestive tract. We also consider removing the role of inflammatory foods. Inflammatory foods particularly include spice, even high temperature foods, and foods which disrupt your digestive system. What I encourage as part of macrophage maximization is the process of realkalinization. How this works: your duodenum, or the first part of your small intestine, absorbs around about 95% of your food nutrients. It does this at a pH of around about 7.2, an alkaline environment. And this is what supports healthy digestion. This helps to also support the reduction of inflammatory bradykinin peptides. This supports a lack of inflammation overall, not only systemically, but also the skin. Your endpoint and result becomes a more proactive macrophage, a more proactive response for phagocytosis, but also chemotaxis, the movement of phagocytic cells into the skin, which kickstart the regenerative process.